A pregnant woman with a large belly, completely normal. But a 5-year-old boy with a swollen stomach hiding another boy inside him? That's not supposed to exist. Yet in operating rooms across the world, surgeons have opened up children during what should have been routine procedures and found something that made them stop mid-surgery. A spine, limbs, bones arranged in perfect anatomical order. Not a tumor, not an infection. A twin brother who never left. This is Fetus in Fetus, and what you're about to learn will change how you think about the human body forever. Picture this. A worried parent brings their child to the emergency room. The child's abdomen is swollen, hard to the touch. The doctors suspect appendicitis, maybe a hernia. They order a CT scan to be safe. Then the radiologist sees something on the monitor and calls for backup. Because what's appearing on screen doesn't look like any tumor they've seen. It looks deliberate. Vertebrae lined up in sequence, just like your spine. Limb buds positioned where arms should be. Bone structures forming in patterns that follow human development. One surgeon described it perfectly in the medical journal Pediatrics. We weren't looking at a mass, we were looking at a person who almost was. That's the moment everything changes. To understand this, we need to go back to the very beginning. When identical twins form, one fertilized egg splits into 2 separate embryos, 2 lives, 2 individuals. But in approximately 1 in 500,000 births, something goes catastrophically wrong. The split doesn't complete. Instead of separating cleanly, one developing twin becomes enveloped by the other. Not absorbed like in vanishing twin syndrome, where one twin dissolves completely. Not attached externally like conjoined twins. Enclosed internally. The weaker twin becomes trapped, usually near the spine or deep in the abdomen, surrounded by the tissues of its sibling. Here's what makes this medically extraordinary. It doesn't develop a brain. It has no consciousness. It cannot survive independently. But it also doesn't disappear. Instead, it remains dormant, connected to the host's blood supply, growing millimeters per year in complete darkness. Sometimes for 5 years, sometimes for 50, without the host ever knowing. Now you might be thinking, isn't this just a weird tumor? And that's exactly what doctors thought at first. There's a rare tumor called a teratoma that can contain bizarre tissues, clumps of hair, random teeth, fragments of bone. But researchers discovered something that changed everything. Teratomas are chaos. Tissue forms randomly, a tooth here, hair there, no pattern. Fetus in Fetus is organized. It follows the axial developmental pattern, the same precise sequence your body followed when you were forming in the womb. This means a recognizable vertebral column, the defining feature, limbs positioned in correct anatomical locations, organs attempting to form in proper order. Dr. Cynthia Hoffel, who published the definitive review in Pediatrics in 2000, put it this way: the presence of a vertebral column is the key. Random tumors don't build spines. This was something that tried to become human. Some researchers still argue it's an extremely organized teratoma. Others insist the spine proves it was a twin. The debate continues in medical literature today and may never be fully resolved.
The rarity that silences hospitals. Let's put this in perspective. Fewer than 200 cases have been documented in all of medical history, across all countries, all hospitals, all time. You are statistically more likely to be struck by lightning, win a significant lottery prize, or be born with 11 fingers. Most surgeons will complete entire 40-year careers without encountering this once. So when it does happen, everything stops. Department heads are called. Medical students are brought in to observe. Photos are taken for journals. Because this isn't just rare. It's a reminder that even with MRI machines, genetic testing, and centuries of medical knowledge, the human body still holds secrets we're only beginning to understand. In India, 2010, published in the Journal of Pediatric Surgery, a 7-year-old boy was brought to the hospital with severe abdominal pain and visible distension. His parents thought it was severe constipation. Scans revealed a mass weighing nearly 2 kilograms, the size of a large grapefruit. During surgery, doctors discovered partially formed limbs, hair and skin tissue, a recognizable spinal column, rudimentary organ structures. The boy had been carrying his undeveloped twin since birth. After successful removal, he recovered completely. Today, he lives a normal, healthy life. The only evidence? A surgical scar and a medical file that stunned his entire surgical team. Across Pakistan, India, and Bangladesh, similar cases continue to emerge. They're documented in journals like the Indian Journal of Surgery, Sultan Qaboos University Medical Journal, and the Hong Kong Medical Journal. From major teaching hospitals to regional medical centers, the pattern is consistent. The patient never knew. The family never suspected, until the day everything changed. Now you say, where it hides in the body, doctor? Most common location, the retroperitoneal space, behind your abdominal organs, tucked against the spine. But fetus in fetu doesn't always follow the rules. Documented cases have been found in the cranial cavity, inside the skull, the thoracic cavity, chest, the scrotum, the liver, and even the pelvis. Each unusual location raises new questions. How did it migrate there during development? Why didn't the body reject it as foreign tissue? How did the patient survive, sometimes for decades, with it growing inside them? We still don't have complete answers. The question everyone asks, is it alive? Let's address this directly because it matters. No, the mass inside is not alive in any meaningful sense. It does not have a functioning brain or nervous system, consciousness or awareness, independent organ systems, or the ability to survive outside the host. It is not a second person living inside someone. It's a developmental remnant, biological tissue that began to form as a twin but stopped developing at a very early stage. Think of it like a book that started printing but jammed halfway through. You don't have 2 complete books. You have one finished book and fragments of a second fused inside the binding. That's what fetus in fetu represents. Not a hidden person, not a parasite, a frozen moment in development, a biological error preserved in time. Once identified, treatment is straightforward: surgical removal. The process? In the vast majority of cases, recovery takes only weeks. No long-term complications occur. The patient returns to completely normal life. The body heals as if the mass never was there, just a scar and a story that sounds too strange to be real. Fetus in fetu forces us to confront something profound about human development. The boundary between one person and 2 people isn't a clear line, it's a process. For a brief window in the womb, we were all just clusters of identical cells with potential. Some of those cells became singular individuals. Some split and became identical twins. And in the rarest cases, something in between occurred. This isn't ancient medical history.
cases continue to be reported across the world, including United States. Modern CT and MRI technology simply allows us to detect these cases earlier and with greater clarity. In the past, many probably went undiagnosed, written off as unexplained masses or abdominal tumors. Now we know what we're looking at, and that knowledge saves lives.
Important clarification. Fetus in fetus does not mean twin pregnancies are dangerous. This condition is common or contagious. People can absorb other people, or all abdominal masses are this condition. The facts: extraordinarily rare, 1 in 500,000, occurs only from specific early developmental errors, poses zero risk to healthy pregnancies, and completely treatable when detected. Somewhere in the world right now, someone is living a completely normal life, going to work, spending time with family, feeling perfectly healthy, completely unaware that deep inside them, hidden in the quiet spaces of their body, is a remnant of someone who almost existed. Fetus in fetus isn't a horror story. It's a lesson in humility, a reminder that medicine, for all its incredible advances, still encounters phenomena it cannot fully explain. A reminder that nature doesn't always follow predictable patterns. And a reminder that the human body, your body, is far stranger, more adaptable, and infinitely more mysterious than we ever imagined. Because the most profound truth isn't what we've discovered, it's realizing how much still remains unknown. For more medically accurate documentaries, subscribe to the channel.